Perceive, process, perform. Do you need inspiration for your practice, or do you simply need to practice inspiration? With this series, we aim to do both. Give us 15 minutes and we'll give you practice inspiration. Dr. Paresh Shah maintains a private practice in Winnipeg, Canada, with a focus on implant, cosmetic, and interdisciplinary care.
Good evening. I'm Dr. Paresh Shah. I'm a Seattle Study Club member. I'm also a director of a Seattle Study Club in Winnipeg, Canada. I've been practicing dentistry for 25 years. Graduate from the University of Manitoba in Winnipeg. And I have a special interest in digital dentistry that I've been experienced with in my practice for probably about 8 of the 25 years. So today what I'd like to do is share with you some information on digital workflows, but more specifically, I want to talk about digital dentistry beyond just doing your everyday single unit crowns. Is there a way to replace, not just replacing our impression materials, but doing things beyond just that? So there are a lot of different considerations for digital dentistry. Implant dentistry and orthodontics, those are 2 key aspects of digital. Also, patient education and having an even more impressive and detailed electronic health record. And then finally, talking about interdisciplinary care and interdisciplinary communication and treatment planning. I mean, that's obviously the foundation of the Seattle Study Club, and a lot of you members here definitely be practicing interdisciplinary care. So I want to talk a little bit about that and help you see the value of digital dentistry beyond just doing single unit crown and bridge. Now, just a quick summary, there are a lot of workflows that are now available to us through digital dentistry. And so if you actually have an impression scanner and or a cone beam or access to both of them, we have the ability to use a variety of lab softwares so that we can actually take your files and actually render treatment and develop treatment designs and so forth. We have the ability to have a variety of different mills, and there are a lot of open systems now where if you have a scanner, you can, down the road, change the type of dentistry that you're doing if you choose to by actually adding a mill. Of course, there are orthodontic workflows as well. We know of Invisalign, it's been around for a long time, but there are other companies now that have developed digital workflows for dentistry using impression scanning. And then, of course, implant prosthetics and implant restorative and guided surgery. We've had a lot of that. And now a lot of the digital workflows are within many of the implant systems and not just 1 or 2 like it used to be maybe 10 years ago. So we have a lot more versatility when you start incorporating a digital workflow. So let's talk a little bit, for example, about implant dentistry. I know it's fairly straightforward in the way we were taught in school. We can basically, an implant's placed, you just put a little transfer coping in there, take an impression, send it off, and it's done. But as we know, as implant dentistry and implant prosthetics has evolved, it can get a lot more complex as people's expectations become more complex for aesthetics and function. And here's an example. We've got a couple of teeth that are failing, and once the surgeon had placed the implants and they sent them back, now we have the opportunity to do something a little bit different. We can actually, instead of taking a conventional analog impression, we can actually place a scan body in there. And this scan body will allow the information to be communicated in terms of the orientation of the implant within the bone to the lab. Through that information and a digital scan of both of the arches, the lab can actually create a virtual model. Through that virtual model, they can create dies where they can work on to actually restore your implants. They can actually put screw access holes. They can actually verify if you can actually have a screw retained crown, or if it has to be cement retained. How you design the abutments, they can be done, and you can be involved in that process without even actually physically having to go to the lab, because a lot of this can be sent through a secure portal and you can actually evaluate that on your computer. You can be involved in the input in terms of the design of the abutment as well. They can print models, they can mill models, so you'll have actually a working model if you choose to do so. And when they do that, you can actually, the digital dentistry right now is really accurate. We have lots of peer-reviewed data to show the accuracy of it compared to conventional analog impressions. So we know we can get really good detail. And a lot of times we're minimizing the adjustments that we might have. So we have the models, we can try them on. Once we go in the mouth, once you've developed that workflow with your lab, there's minimal to no adjustments at all that you have to do, which is the beauty of all of this, because we have the ability with digital dentistry to control our contacts, control the occlusion, and really be very precise so we can get predictable results. And we can save money a lot of the times, because when we're doing even single tooth dentistry, most of the time now, I'm doing it model-free. So here's another case where we had a couple of failing implants. The surgeon had placed in implants to do a bridge. We did the scan bodies from the lab and created a zirconia bridge that went over these areas with custom abutments. And again, very precise fit, not a single adjustment at all, but everything was dialed in the software with the lab and with great accuracy and predictability. So, what's another thing that we can do with digital dentistry beyond just doing dental implants or orthodontics or just basic restorative? Well, here's a big part that's been incorporated into my practice, and that's patient education and records and documentation. Our typical comprehensive exam that we'll do, we'll have a periodontal assessment, we'll have a full mouth series, Panorax, photographic series, and then if you're doing cases, you'll have a diagnostic wax-up. The purpose of that wax-up is to be able to give the patient an idea of what they might be able to expect, as well as allow us a blueprint or a roadmap to do our treatment. And we try and use that, create a matrix, make sure we're prepared for the case. And this is how we've done it for years. This is how we've been taught in school. And then we can go ahead and treat the patient, use our wax-up and our guides to be able to fabricate the final restorations. And you get fairly close to what the patient wants to, what their desired results are. But now we can take it to a completely other level. And this is what we've done in our practice, is we've actually had the entire team, including our hygienists, be involved in this process. And they actually are now scanning all of our new patients and our existing patients when we do comprehensive exams. So we actually have a 3D record of their bite, their teeth, their tissues, everything. We also are starting to take video and photos. This is part of the Digital Smile Designer DSD protocol that we have incorporated into our practice. It allows us to do treatment planning with our specialists, to do communication with our labs, to engage the patients, because we can actually do mock-ups in their mouth that are actually true and actually fit within their smiles. We can create surgical guides and templates for them as well. What more power can you have when you have a 3D image like this that you can actually turn around 360 degrees and even have a patient be able to see like a caries or erosion on the lingual of their teeth and actually have a digital record of it. Having HD photographs that you can actually send to the lab, communicate with the patient with, where you can actually take shading measurements that have fairly good accuracy for communicating color to a lab. Okay. But it allows us now to do facially generated treatment planning using this digital smile design workflow protocol. So with just a minimal series of photographs and or videos, ideally some photographs and videos that were developed through the DSD protocol by Christian Coachman, we have actually incorporated that in our practice to engage our patients in terms of treatment possibilities that we have, but also the interaction with our specialists to be able to diagnose and treatment plan cases more predictably and more effectively, and involve the patients in that. For example, when we take a scan, an intraoral scan, we can actually have that scan paired and superimposed with our intraoral photographs and videos, and then create a diagnostic wax-up that traditionally the lab would do with wax, tooth by tooth, but now they can actually do it in the lab on software. And so they can manipulate that. I can communicate with the lab what we want. From there, they can actually create a 3D file, print that out instead of pouring a model, and the printing is with great accuracy, and it allows us then to be able to go back to the patient and try it actually in the mouth. So here's another case where you can actually do this with really complex interdisciplinary treatment, where we can actually allow us not only to communicate with the patient and give them an idea of the possibilities of treatment, but we can now involve our specialists when we are doing cases. For example, this particular patient, she essentially came in, she had a lot of work to be done. This is a full mouth case. She had gone to a dentist, had a couple of implants placed in, and then realized, you know what, I need more than just this. So we saw her, and we actually did a scan, took all the videos, took all the photographs, worked with Orem Labs, who I work with and have a tremendous amount of experience. So I was able to learn through them how to go about doing these procedures. But we took the series of photographs and then created a smile design, basically a treatment plan of how we wanted to design her smile and her occlusion based on her request and her requirements. And we were able to do that with great accuracy. Once that was done, I got a chance to actually see this in a 2D rendering. Patient didn't have to see this part because they're going to actually test drive this. We got a chance to have a dynamic evaluation where you can actually have them talking, just conversing, and allowing the lab to see the conversation and the lip dynamics that the patient has. From there, we have a cone beam, and the cone beam is paired with the 2D rendition of the digital wax-up, as well as the scan, the intraoral scan. Now we have all three, so we can actually sit with the surgeon and actually design where implants need to be placed, if there's grafting that needs to be done, sinus lifts, extractions, any of those things. And once that's done, and we decide where we want everything from the final result, the lab can actually create a trial smile for us. And so they actually print the model from that whole digital smile design, and now we can go inside the mouth with some acrylic, some BIS GMA, and actually try that in the mouth. Now this can be used just as a trial to see if we're on target, but it can also be used as motivational and as a motivational mock-up to possibly entice the patient into wanting to, or being able to see the possibilities of the treatment options that we're providing for them. And a lot of times they really like it and they want to go ahead with it. And if you've already got the patients accepting the treatment, it allows you to verify your treatment planning. But the ability to use digital allows us to communicate with the different specialists and the lab, and sometimes we can't physically be on that spot at the same time. So it allows us to do that virtually. When we tried this mock-up in, there was absolutely no adjustments to be made. It actually fit perfectly because we had already dialed it in digitally. The occlusion was very, very accurate. They were able to see their smile. We were able to make milled PMMA provisionals that she could actually wear over that while we're getting started with the treatment. And we can then go back and reverse engineer a surgical guide that the surgeon can use for the implant placement. So great accuracy. So these are a lot of other things that we can do with digital dentistry beyond just replacing impression material. So we need to realize that digital workflows can be used for implants, orthodontics, complex treatments. It's now going to be a patient record. We can use that to superimpose images over a period of time to make comparisons and have reference points for past history. And we can certainly increase the communication with the interdisciplinary team. I've been able to incorporate this in my practice. I have my entire team, 3 hygienists, 2 assistants, all learned how to scan. So we've incorporated a DSD protocol, and I can certainly show you how to accomplish that as well. Thank you very much for your time.